Hi guys, so this video is about therapeutic modalities. There is this one thing called psychotherapy, which is the treatment of emotional problems and disorders using psychological techniques. The following are psychotherapeutic techniques used by psychiatrists, psychologists, and other mental health professionals. Number 1 is cognitive behavioral therapy, abbreviated as CBT. It's a relatively short-term, focused psychotherapy for a wide range of psychological problems, including depression, anxiety, anger, marital conflict, fears, and substance abuse. The focus is on how the person who is experiencing difficulty is thinking, behaving, and communicating today, rather than on early childhood experiences. Because CBT is based on the idea that thoughts cause feelings and behaviors, and not people, situations, or events, if the person can change established ways of thinking, then he or she can feel better even though the situation does not change. CBT techniques are often used to reduce anxiety. The next one is family therapy. Treatment of an entire family can help the individual members resolve and understand their conflicts or problems. And then next one is group therapy. In a group with a mental health professional leader as a neutral moderator, patients with similar problems gain insight into their own personalities through discussions and interaction with each other. In psychodrama, patients express their feelings by acting out family and social roles, along with other patient actors on a stage. After a scene has been presented, the audience, composed of other patients, is asked to make comments and offer interpretations about what they have observed. Next is hypnosis, which is a trance or state of altered consciousness is created to help in recovery of deeply repressed memories. Hypnotic techniques are also used for anxiety reduction, for creating a sense of psychological safety, and for problem solving. Next is insight-oriented psychotherapy. This type of psychotherapy uses face-to-face discussion of life problems and associated feelings. The aim is to increase understanding of underlying conflicts, themes, thoughts, and behavior patterns. Next is play therapy. In this form of therapy, the child uses play with toys to express conflicts and feelings that he or she is unable to communicate verbally. Next is psychoanalysis. This long-term, intense psychotherapy seeks to influence behavior and resolve internal conflicts by allowing patients to bring their unconscious emotions to the surface. Through techniques such as free association, which is when the patient speaks his or her thoughts one after another without censorship, transference, which is when the patient relates to the therapist as if to a person who figured prominently in early childhood, such as a parent or a sibling, and dream interpretation, the patient is able to bring unconscious emotional conflicts to awareness and thus can overcome these problems. Next is sex therapy, and this form of therapy can help people overcome sexual dysfunctions such as frigidity or impotence. The last one is supportive psychotherapy. The therapist offers encouragement, support, and hope to patients facing difficult life transitions and events. The next one is really short. It's known as electroconvulsive therapy, shortened to ECT. In which an electrical current is applied to the brain, usually to one hemisphere, after the patient is anesthetized with assisted ventilation and is given a very short-acting muscle paralytic agent. Actual physical convulsions are therefore imperceptible. The therapy is used chiefly for serious depression and the depressive phase of bipolar manic depressive disorder. ECT is a particularly effective treatment for psychotic depression and can be life-saving when a rapid response is needed. Drug therapy will be in the next video, and that's it for this one. Bye guys.